So in this section, they talk about how the current agent model is not designed to guide and educate clients on the differences between Medicare Advantage and Medicare Supplement. I would like to invite any of the authors of this report to attend one of our agents' turning 65 appointments or educational events. Agents educate these consumers so the decision that they make is a lasting one. Good morning, insurance agents of the senior market. Welcome back to Near and Far. It is Wednesday, May 5th. Got a really important, maybe the most important episode we have ever filmed to bring to you today. So let me ask you a question. How many of you have heard of the Commonwealth Fund? So a lot of websites that I tend to traffic, and you guys know I read a lot, have been talking about this article by the Commonwealth Fund. So here's how they describe themselves on their website. Their mission is to promote a high-performing health system that achieves better access, improved quality, and greater efficiency, particularly for society's most vulnerable. Seems like a pretty good group, right? Really out for the common good. So there's a recent article that I've seen, originally published on April 21st. Again, seen it on many of my favorite websites, and you'll see a link to that article in the description. The article is titled, How Agents Influence Medicare Beneficiaries' Plan Choices. Seems rather innocuous, right? Okay, it's talking about insurance agents just like you and how you're working with Medicare beneficiaries. This article attacks the integrity and skills of the entire independent agent community and how they work with clients. They're attacking you. So I'm going to do a couple things today. Number one, I'm going to expose where they're wrong in this article. But more importantly, I'm going to explain to you why they published this piece and what their reasoning for it was. So number one of the first points they make in this article is that you, the agent, narrow plan choices. So the report talks about how agents who basically don't offer every single plan in a particular market are doing their clients a disservice. And also, they imply that the reason that agents like you do this is based upon finances, on how much you're getting paid and what you're making, your financial interest in it. Guess what, Commonwealth Fund? The point of working with an agent, the point for a consumer to work with an agent is to do exactly that, to narrow the field of choices for a consumer in an environment where there might be 50 Medicare Advantage plans available. It is indeed a Captain Obvious moment. So tell you what, let me give you an example of how this works in the real world. I'm going to use some magic right now. I'd like some enrollment forms, please. So here I have not even all of the Medicare Advantage plans available in Western Pennsylvania. These were just the ones that I could appear through magic into the studio from our supply room. Here's what agents do for clients. Here's the first plan. Nope, terrible hospital network. This one's formulary, really bad. Too many drugs that are generics on tier 3. This one, terrible network for durable medical equipment. Here's this one, doesn't include the most important primary care physicians in the area, and so on and so forth. Here's another one. This one's really highly overpriced and they don't offer great copays, and so on and so forth. They are narrowing the plan choices for consumers to try to get them to the plans that they will be satisfied with. Here's this one, terrible customer service. Every consumer I've enrolled in this plan has complaints. Here's this one, always screw up the premium payments, and so on and so forth, on and on and on and on. Until an agent is maybe left with 5 plans that typically are appropriate for consumers, that do a great job in managing claims, in doing all of the things, great formulary, hospital network strong, great group of providers, reasonable copays and premiums. That's the reason that consumers work with an agent, is to narrow the choices from 50 to a meaningful number that they can actually make an appropriate decision. So number 2, the second point that the Commonwealth Fund's report tries to make is that you, the agent, don't guide and educate your consumers on Medicare. This section, which includes the feedback of patient advocates, to me is incredibly inflammatory. Now, while they talk about how knowledgeable agents in sections of here, they're implying that most of you are not. And we're going to reveal at the end of this video exactly why they are making this implication. So in this section, they talk about how the current agent model is not designed to guide and educate clients on the differences between Medicare Advantage and Medicare Supplement. I would like to invite any of the authors of this report to attend one of our agents' turning 65 appointments or educational events. I'd like to invite you to come and see how the agents that work with us and agents that don't work with us are helping their consumers understand what is original Medicare, how does it work, what's the difference between Medicare Advantage and Medicare Supplement, how do you try to go about making those decisions, what are the full range of items that you need to understand in order to try to make an appropriate plan selection. And then once you're on a plan, how do you best utilize those benefits? What's an appeal and a grievance? How do you file them if something goes wrong? Agents educate these consumers so the decision that they make is a lasting one. So third, in the conclusion section of this article, the authors talk about a number of things that they think are really items to do moving forward. Their conclusions following the conclusion of this article. So they start by saying you got to invest in Medicare.gov and unbiased advocates like SHIP counselors. So I'm not going to disparage those folks, okay? I'm not going to disparage SHIP counselors. Medicare.gov, the reason why consumers work with agents is when they do a search on Medicare.gov, they get 35 to 50 plans. They don't know where to start. That's the whole point of working with an independent insurance agent. But in this section, they talk about working with the, again, high quality agent, and then go from there to talking about boosting support for those that provide Medicare education. So insurance agents don't provide Medicare education, only Medicare.gov and SHIP counselors provide Medicare education. Please. Now, here's another question. When I looked at who did the authors of this report, who did they speak to when they put this together? Did they talk to a single insurance agent? Nope. Did they talk to NAHU? I mean, for Christ's sakes, NAHU is the preeminent organization working in healthcare that works with independent agents. Do you think that if the Commonwealth Fund was putting this report together, where basically they're talking about how independent insurance agents aren't educating consumers or are narrowing plan choices for financial means, do you think they would speak to NAHU about it? Nope, they didn't do that either. The entirety of their research for this report were online searches and speaking with patient advocates who were not involved in the independent insurance agent distribution model. So the report then goes talking about how more access needs to be created for unbiased Medicare information and proposing that there needs to be a list of high quality insurance agents that is available to consumers. Why do you think that they're doing that? Why do you think that is part of the proposal? So at this point, I'm going to expose the authors here and the actual purpose of this article. Again, this article published by the Commonwealth Fund, who talks in their mission about creating better access, improved quality for society's most vulnerable people. This is the group that's bringing this article. So let's talk about the authors. 4 of the 6 authors work for a company called Saeidan. Not Satan, as in, he who lives below the ground in hell. Saeidan. Well, guess what this company does? Let's talk about that. It's very interesting when you click on the bio of an author to see what it is that they do. So 4 of the 6 authors work for this company. And I said, oh, well, I'm interested. What does this company do? So this company is building a website that's going to launch a tool in the summer of 2021, right around the corner, whose goal is to provide unbiased Medicare education, where have we heard that in the article, as well as a list of Medicare agents, high quality Medicare agents for consumers. And that's where we come to their tool, Claire's List. Claire's List. Well, I've heard of Angie's List. Is it kind of like that? Like, oh, I wonder. Well, basically, Claire's List is designed to try to be Angie's List for Medicare insurance agents. So let's talk about this article. This article is a prime example of complete and total hypocrisy, okay? The article positions that you, the senior market insurance agent, are narrowing plan choices and the available plans that you offer to Medicare consumers for money, as well as the fact that you're not educating consumers beyond anything on plan selection. You're not educating on original Medicare or appeals and grievances or any of those different things. And yet the authors of this article, the people that wrote this, that put you, the independent agent, in the crosshairs, what are they doing? They are building a tool that they're looking to launch that will, A, educate people with unbiased Medicare information, as well as the fact that they're going to provide a tool for consumers to try to search for a high-quality insurance agent to make money for their company. This is why when you read some of these articles online, you need to really think about who's writing them, why they're writing them. And I would tell anyone in the world who reads this article, don't you dare say terrible things about the independent Medicare agent distribution. Are there good agents and bad agents? Sure. But as a whole, the independent insurance community is trying to work really hard to help Medicare beneficiaries choose an appropriate plan for them. What they aren't doing is writing an inappropriate article where they're casting shade at an entire profession specifically for their financial gain. We will be back with you on Friday, May 7th at 7 a.m. Hopefully with more enjoyable content, maybe with some laughs. We'll have to see. I'm Bill, and this has been Near and Far.